Aboriginal mental health first aid training is for people, frontline people, our community mob, to commence having conversations about Aboriginal mental health first aid, the mental health issues and the challenges and the celebrations that we have out in community.
My name's Wayne Coles. I work for myself and deliver this program.
My name is Dara Jones. I got contacted from AHCWA with the Culture Care Connect to go and deliver training, Aboriginal mental health first aid training.
People ring up and say, would you like to do a workshop? I say, yeah, I'd like to do the workshop.
My name is Brandon Eads. I'm a Belladonna Noongar. I did 2 days, and it was, I don't know, it was information overload, but it's good, necessary information. It's not, it kind of goes into the main parts of the different mental health.
My name is Kira Lou Kenny. I didn't know what anxiety was, I didn't know what depression was, I didn't know what suicide was, and I didn't know what caused suicide. So having the mental health first aid training was where I needed to start.
My name is Shanice Stacey Ballman. I believe mental health is one of your top priorities, because I do believe learning more, a lot of things stem down from your mental health.
Yeah, my name's Clinton Yaron. I'm a Noongar man. It's quite important just to deal with things and address these issues, make it more culturally appropriate as well to help any our mob dealing with depression, suicide, aftercare, interventions, behaviours, triggers, traumas.
I'm Madeline Doyle. I think of it more like in a first aid kind of approach where, it's giving me all the tools and information about how to, best respond to somebody, or how it would best prepare me to be able to respond to someone that potentially is in a crisis.
Mental health first aid should be just as important as St John's first aid. We think about the physical first aid, we also should be thinking about the mental health side of a lot of people.
So Aboriginal mental health first aid training is aligned to the workforce that aligns with each Culture Care Connect site and their community controlled suicide prevention networks. So it's really an important training. It's been really well received across all of the sites, particularly some of the remote communities. And will you be able to talk a little bit about some of the experiences in the remote communities from the trainers that have been out there? Can you tell us a little bit about that?
Yes. I talked about the gaps that are currently in services. When we look in remote communities, that it is so remote that we're waiting on resources to come in there, or there's fortnightly visits like a fly-in, fly-out service. And when we look at the training, like I said previously, we actually are giving them tools, we're giving them mental resources so that they can pick up signs and symptoms of someone in a crisis.
With Aboriginal mental health first aid, we look at that social emotional wellbeing part, which is missed out in standard mental health first aid. So we look at people as holistically rather than just their mental illnesses.
Like the connection to country, if we get taken off country or we move off country or come down here for hospital, someone who comes down here for hospital treatments and they don't have a connection to country here, how that could affect their mental health or their connection to culture or their connection to family and kinship. If they don't have a strong family, how that can affect their mental health.
I was hoping that this will set me up more for, I suppose, the role in Durban, given that we've got the clinic side, with doctors and everything, and we've got people that are sick that come in most of the time. So I was expecting it to be somewhat like how we can help really more with the mental health of any type of clients.
I've seen it work instantly in workshops, I've seen, and people have shared, and they go away and they're empowered. We do need to be able to put things from inside outside, and and even look at them and say, okay, because not all the stuff we have is good for us. And if we can identify what's not good for us, we have a choice then. We can say, well, I don't want that in my life. So we can just let it go, you know what I mean? And not hang on to it. And I just see a lot of people that, can benefit from having a yarn with somebody. It's not telling people what to do. It's sharing and letting them share, and then offering some advice, and what they do with it is their choice.
You can relate it back to anybody outside of work at any age, really, being able to identify maybe key issues or characteristics with somebody that you might know that potentially could be suffering from mental health issues. I guess these first aid tools is, a way to be able to kind of identify that and safely approach it.
Feedback that we've received from participants, from the trainers and from community has been, really amazing in terms of people's mental health literacy increasing, in terms of their knowledge about specific mental health diagnosis and illnesses in a culturally appropriate way for community and for mob. I think it's been really reflected in feedback about the training. Can you talk me through the approach that people learn within the training program?
Yeah. So when we look at AHCWA, and that's the instrument for the Aboriginal mental health first aid, we're looking at learning how to is the approach, assess and assist, with the crisis.
Yeah.
And we also learn that if it's not a crisis, we can move on to action 2, which is listen. And we're listening in a sensitive, non-judgmental way. So we're learning to be challenged by that.
Yeah.
We're giving information. And E is for encouraging professional supports and encouraging other cultural supports that may be in a remote community.
Yeah.
So that's what AHCWA stands for.
People do this. They do apply AHCWA to whatever mental health problem that they come across, but just didn't realise there was rhyme to why they do it. They sit and they listen to people. They give that support and information already, telling them to get to the doctors, get to the hospital. So people do it, but now just being able to teach them those signs and symptoms as well about what's going on from sitting down and helping with people.
I think the training is quite important for our men too, because, don't get me wrong, the matrix is quite important for us. Muj mum is making us still feel stronger, that we feel loved, feel wanted, feel worthy, feel empowered. Also important for us to not to be shy, also to get out of your circle when you're ready to want to get out of the circle, and feeling comfortable and confident to step forward.
Yeah, it's 2 days of your life and it's jam-packed with a lot of knowledge, and it's the stories that go around the classroom as well. You learn from the facilitator, but you're also learning around the classroom as well.
I think mental health affects so many people, particularly in men, so I really would encourage conversations with men, cousins, brothers, uncles, and really creating that safe space for somebody to really bring forward any mental health issues and offering your help and support.
If this is something that you want to do and your gut's telling you to do it, just do it. Because it is very rewarding every time you find out, which you don't majority of the times find out, who you've actually helped. When you do, the feeling is just so... There's so many different words. It just feels so warm within your body to the point where you've done something right, you've helped somebody.
It's helped me from being a young spring onion to where I am now. The course is amazing, the course is helpful, the course needs to be out there, it needs to be all the way through the country, it needs to be all the way through the state, it needs to be a lot in youth as well. So I think Aboriginal youth mental first aid is where we need to start with our young ones.
If you get the opportunity, get along and do the Aboriginal mental health first aid.
If we can sit down and just go through the basics of mental health first aid, or how to apply AHCWA, or people learn that, that's the bonus of it all.
We can only go out and encourage people, and I just hope people from the training learn enough to be able to go out and say, I can support this person.
Mental health doesn't happen during 9 to 5. It doesn't happen Monday to Friday. It's our mob who are dealing with people 24/7, family, friends, and even working in the industry with health anyway. People always come to you for help. So after hours, knowing where to get that support and how to support people.
But this is something that we can make a difference in by having this knowledge. Knowing signs and symptoms to help a person in a mental health first aid crisis does save lives. That's why I've worked with such a passion for such a long time. 37 years in the space and 11 years as an instructor.